Welcome. I'm Dr. Jen Bickerton, founder of the Vitamin Advisor and the Vitamin Advisor podcast. I'm here with Dr. Emmanuel Apostolidis, the co-founder of Nutramins. Today, we will be discussing one of Nutramins' products, Jointforce. Dr. Apostolidis, a nutrition biochemist, is an adjunct associate professor at the Harvard T.H. Chan School of Public Health and a professor at Framingham State University. He has been involved in research for over 20 years. Welcome, Dr. Apostolidis. Thank you for being here today.
Thank you, Dr. Bickerton.
I would like to start by saying Q-actin, the clinically studied branded ingredient in Jointforce, won the Nutrition Industry Executive Award in 2021. This must have been really exciting news. And I want to ask you, what are the benefits of Jointforce with Q-actin?
The benefits of Jointforce are reduction of joint pain and joint inflammation and improvement of joint flexibility. Customers that use Jointforce can feel the effect within the first month of use, and they can increase the dose if the pain becomes more intense.
So Jointforce is part of the Nutramins brand. Give me a quick description of the brand focus and tell me how Jointforce fits within the brand line.
Nutramins' philosophy is to provide clinically validated dietary supplements that help people achieve healthy aging and maintain an active and healthy lifestyle. Jointforce, as we said before, is a dietary supplement designed for inflammation and pain management. As we grow older, joint pain and joint inflammation is a very common problem. And this problem prohibits people from having an active lifestyle. We developed Jointforce in order to provide a natural solution for joint pain management. And in that way, we can allow people to maintain having an active lifestyle, which is very important for healthy muscle strength, which is one of the major strategies in order to control joint-related problems.
So can you tell me a little bit about Q-actin? This is the clinically studied and branded ingredient in Jointforce.
So Q-actin is a branded ingredient, and it's a cucumber extract. Q-actin is produced by using specific varieties of cucumbers that contain high levels of aminosugars. Aminosugars are sugar analogs that a nitrogen atom substitutes the oxygen in the ring structure. Aminosugars don't exist in all cucumbers, only in specific varieties. That's why Q-actin is using specific varieties in order to be produced. And the unique aminosugar that is present in cucumbers is called IDO-BR1. The company producing Q-actin has investigated a lot this aminosugar IDO-BR1, and they have defined a very unique health property, which is anti-inflammatory effects through TNF-alpha regulation. Q-actin is a cucumber extract that is standardized to contain at least 1% IDO-BR1.
And that's important. Q-actin has been studied for over 10 years, I know. Can you highlight some of the studies for us?
Initially, Q-actin was studied in various in vitro trials in order to understand the mechanism of action of IDO-BR1. But what I want to share with you is the two published in peer-reviewed journals clinical trials that demonstrate the efficacy of Q-actin in subjects that suffer from moderate osteoarthritis. And I have a few slides that can show the results in a better way. Would it be okay if I can see my screen?
Absolutely. Go ahead and share those.
Thank you. One moment, please. Can you see it now, Dr. Bickerton?
Yes, I do. Yes, I
Very
do.
good. So Q-actin was evaluated in 2 clinical trials, as we said, with subjects that had moderate osteoarthritis. And the first clinical trial lasted 6 months and compared the effect of 20 milligrams Q-actin, which is the dose that we use in Jointforce, versus 2.7 grams of glucosamine chondroitin, which is the most widely used approach for people that have joint problems. And we observed in the duration of 6 months that Q-actin reduced the WOMAC score by 70% compared to 32% reduction that was observed from the glucosamine chondroitin treatment. Q-actin reduced VAS pain score by 46% compared to 25% reduction from glucosamine chondroitin treatment. And Q-actin reduced LFI score up to 26% compared to 8% reduction from glucosamine chondroitin treatment. Now, what is important to state is that in all biomarkers that we observed, Q-actin behaved much better, helped much more the subjects compared to glucosamine chondroitin. And another thing that I would like to mention is that we were recording the observations every month. And we observed from the first month of consumption of Q-actin some improvement. With glucosamine chondroitin, it took a little bit longer in order to start seeing the improvement. The second clinical trial actually lasted again 6 months with subjects that have moderate osteoarthritis. And this time we compared the dose-dependent effect of Q-actin. So we had the placebo group, the 20 milligram Q-actin, which is the dose we use in Jointforce, and the 100 milligram Q-actin. And we observed indeed that there is a dose-dependent effect. As we were increasing the dose, the reduction of WOMAC score, VAS pain score, and LFI score was greater. And this shows that, proves that there is a dose-dependent effect. And if there is more pain, we can increase the dose in order to have a faster and more strong effect. So as a recap, the clinical trials that we observed demonstrated the reduction of the improvement in all of the factors compared to glucosamine chondroitin, but also demonstrated the fact that as we increase the dose, we can get a better effect. So if we have intense pain, we can definitely increase the dose.
Yeah, this is really important to know, especially for our natural health practitioners and chiropractors, naturopaths. By the way, I want to mention really quickly, we do have a protocol guide for our health practitioners, and you can reach out to nutramins.us or the Vitamin Advisor. But let me ask you about the other ingredients that are in the Jointforce formula. And why did you design the formula with other ingredients with the Q-actin?
In addition to Q-actin, in Jointforce, we have turmeric extract, copper, and vitamin C. The turmeric extract we're using is standardized to contain 95% curcuminoids and acts synergistically with Q-actin in order to manage inflammation. The dose we are using is 80 milligrams, and the daily dose is 80 milligrams in 2 capsules. Copper is a mineral that contributes to the maintenance of normal connective tissue, and a recent study that was published in 2022 demonstrated that copper deficiency exists in modern Western diets. In our formula, we are using 1 milligram copper daily dose, which is 100% of the percent daily value. Finally, we use vitamin C, which is a vitamin that contributes to the normal collagen formation. In the Jointforce formula, we are using 80 milligrams of vitamin C, which corresponds to 100% of the daily value.
Excellent. Now here's my last question for you today. What prompted you to develop the Jointforce product with the award-winning Q-actin ingredient?
Uh, First of all, the major reason I used the Q-actin ingredient is because it is a very well-studied, well-defined ingredient with a very clear mechanism of action, and it is efficacious. Consumers can see the benefits. And I want to share with you a story that I have shared in the past also that has to do with how I was exposed to Q-actin, which was more than 10 years ago at the supply side West, when a company that was marketing Q-actin back then gave me a sample. And the clinical trials didn't exist at that point. They were just understanding the mechanism of action of IDOBR1. And it so happened at that time to have a back pain. And I was out of Advil. So I asked the director of R&D that gave me the samples, how much can I take? He told me, take as much as you want. So I did follow his advice. I consumed a lot of gummy bears. There were gummy bear samples. And surprisingly, at night when I went back to my hotel, the pain went away. So the next day I stopped by again, like, I think this product will work. And I took more samples, and indeed, it worked. And we see it now, in addition to my personal exposure from our customers that have been using it.
Well, this is a fantastic product. But one clarification, the Jointforce is not gummies, they're capsules. But this is a wonderful product. Jointforce specifically can be used by health practitioners, by chiropractors, by naturopaths, looking for dietary supplement to support their work with arthritis patients and patients wanting to support their physical activities, their joint flexibility, their mobility, their joint comfort. So I just want to let all of our listeners know, if you would like more information about Jointforce, we have a protocol guide for health practitioners. You can find us at the Nutramins.us website. And you can also reach out to me, Dr. Jen, at thevitaminadvisor.com. And Dr. Apostolidis, I want to thank you so much for sharing this information. It's remarkable, and I know a lot of our health practitioners are going to appreciate it. So thank you so much for being here today.
Thank you, Dr. Bickerton. It is always my pleasure to be with you.
And until next time, see you then.
See you.